focused on men's mental health. I'm not trying to divide out the sexes, but do you see that shame affects men differently? They have a harder time overcoming that than maybe women do. I don't know if that's even a fair question, but any sort of take you have on that, I'd love to hear that.
You know, it's interesting because if you look at the numbers, even surrounding substance misuse, men dominate.
Yeah.
Right.
Yeah.
So to answer your question, I think initially, yes, it affects, men as going back to the shame and just sort of sitting in that, which can perpetuate somebody to continue the substance misuse. I don't want to get into generalities between the sexes here, but I know that for me as a male, I can be very stubborn as well. And it's very hard sometimes for us to kind of reach out for help because we don't want to have that vulnerability, right? We don't want to put ourselves in a hard situation and say, oh, right, going back to the whole idea of I need to be strong, all those societal and familial expectations and stuff. And so, yeah, that's what I would say for men. For women, I think that it's just more easier, in my experience, to accept that they have things going on. Yeah. They're going to reach out for help, and they oftentimes do.
Yeah. Can you repeat the question, Brett?
Yeah. I was just trying to ask if you have noticed or if you've seen in your work that maybe shame affects men differently than women, or if men have a harder time overcoming shame, just sort of that general, kind of around that general question.
So I definitely think men deal with shame and stay in shame much longer. Because we really got to talk about how do you overcome shame, right?
Yeah.
And to overcome shame, like, people have to hear your story, right? And people have to validate you. How often do men tell their stories to other men, right?
Right.
And so that in itself is where I see, like, the healing happen, but it's not really happening for men who have to be stoic and, I'm just going to internalize everything and everything's fine, like we're men, we're supposed to go through things and this, that, and it's like, I don't know what cyborg you are, but no, like I need people, I need friends, I need family, right? It's like we're not meant to take on the whole world alone, and so I think a lot of where the healing happens is. And we can even talk about it from the different perspectives, right? Yeah. Men get beat by women, right? There are men who get sexually assaulted. We don't talk about it enough in our society, but this happens, right? And these men don't talk about it because they're ashamed that this happened to them, right? How do they get healing? They get healing when they talk to other people who've experienced the same thing, right? And they are validated instead of, man, why don't you just hit her back? Or, what the obvious answer would be when you're telling somebody who may not have gone through something like that. So it's really like, do we have the opportunities for our pain to be heard, right? And when our pain is heard, are people responding in a way that is conducive to our healing? Or is it something that's going to make us retreat because, I was vulnerable and they laughed at me. I was vulnerable and they, told other people. Because when that happens, you're never going to speak to anyone else again, right? You close up, and this avoidance continues, right? Yeah. And so, but like, that doesn't make the feeling go away. I got to deal with this negative emotion somehow, right? And that's where the addiction part comes in, right? Because it's like, I have to numb myself.
Oh, yeah. You talked about overcoming shame and telling your story is part of that healing process. Are there other ways for people to overcome shame? And a quick follow-up, where are spaces that men could go to share those stories, to find a place of healing? Are there places in Nashville? Are there resources that we could maybe point out to anybody watching this, the places that you know of?
I mean, I'm not recalling any just off the top of my head.
Sure.
I don't know if there's any specific meetings where people are going to, whether it's AANA, where some people are just making it just men only, where they can do that. Or any support groups. Benias, are you familiar with any?
So we at the Black Mental Health Village, we have a support group for Black men. We do hikes and things like that.
Great.
And like we found that to be super effective because from the minute that we're out there, people are just dumping all the things that they've been holding back, right?
Yeah.
Because if you say it to your spouse or partner, you'll be seen as weak, right? You can't necessarily talk about the things that you're going through with somebody who you're supposed to show up as, the leader and the provider. And so because of these dynamics, we really do have to create spaces. I know another one is Mindful Nashville. They did a men's circle once. Yeah. Was it you that invited me or somebody?
No, it wasn't me.
Okay, yeah. So somebody invited me there. So Mindful Nashville, but and we have Men of High Integrity and Quality. That's the group that's partnered with Black Mental Health Village that we do the hikes and things like that. And we actually have a men's month that we got scheduled in November, trying to get more people to talk about mental health. We do a panel, we do like a field day for the kids and stuff like that. But just creating opportunities because there are a lot of men that are going through it alone, and it's difficult for them to navigate all these things. Yeah. And they feel like they have nobody, right? And that's the society that we've created. Because even our neighbors, how easy is it for us to knock to our neighbors, hey, can you help me, get sugar, this, that? We don't do that anymore. What do? We Grubhub it, right?
Right.
So we don't have relationships anymore.
Yeah. So on that, now I have a question for you. So I have a situation where, the question is, how important is acceptance in shame and guilt? But I have two different example situations that I can use from my life personally. So when I was in high school, for the ninth grade, I went to an all-white school, and I was the only non-white person in that school. And the culture there made me feel very ashamed of me being Egyptian, me having an Arabic name, especially this was post 9/11, fresh post 9/11 America. So it was not cool or accepted or, fine or whatever to be in this all-white Christian school. I ended up getting expelled from the school because I was 13, 14 years old, so it was coming out in aggression with me, so I would get in a lot of fights with people until eventually I got expelled from the school. And to this day, I still struggle with that societal shame, like that shame that comes from racism, or the shame where you're in a space where people are acting a certain way, being a certain way, and it's looked down upon, or it's kind of shameful to be something that's not. That can come out in the library sometimes too, with intellectualism and being really like academic, or being really civilized, well-spoken, like all these different things. So there's that kind of aspect, and that's a shame that I haven't still been able to accept or figure out how to work my way around that. But then also when I was in high school, I had I guess you could call it an addiction to being on Tumblr and creating like mood boards. And Tumblr would take my time for 8, 9, 10 hours. I would stay up all night just scrolling Tumblr and looking at like so many different things on there. And then I would make pacts with myself and being like, all right, I'm not gonna get on Tumblr. I'm not gonna do this. I'm not gonna do this. But I would still do it. Then eventually I had to sit with myself and go, okay, like I accept this fact that I'm addicted to this social media site, Tumblr, and now I'm able to, and this is like a 15-year journey, and now I'm able to slowly wean myself off of doom scrolling for hours and hours. Both of those have to deal with acceptance, but one, the shame is coming from internally, and one, the shame is coming from externally. So what is the role of acceptance in external shame and internal shame that you would say to, I don't know, teens, young adults, young men out there that are dealing with something similar?
I think internal acceptance, just realizing that stereotyping, labeling the other as a means of control and power exist in the human condition, and learning to love yourself, your culture, know that you have a place as a human being in this world. I know that's very easy for me to say as a male Caucasian, responding to somebody who went to an all-white school and you're the only Egyptian there, right?
Yeah.
You know, as far as so I think it's just that process, and I mean, I know this is going to sound, you know, very clinical. Obviously, therapy has to be a part of this process to be able to, because a lot of times for men, we love to rationalize our emotions, right? We didn't grow up like learning like emotional intelligence, right? Like how to actually process feelings. But as far as the external, I think it's just that awareness, right? You have that awareness that, oh, what I'm doing is clearly, you know, affecting me in all these different ways. And it allows you to say, let me put up some boundaries with myself to accept that, okay, I am, because again, acceptance, as far as the external stuff, you just have to realize that is step number one to even realize that you even have an issue going on, right? And because you did that, you put those boundaries up for yourself and say, what do I need to do with my life to create more balance and sort of eliminate that shame? Because in and of itself, that very activity of scrolling is not evil. It's not, you know, any of that. However, too much of one thing is not a good thing, right? So, yeah.
Oh, yeah.
And was the shame from like, were you ashamed about how much time you were spending, or
Yeah,
was it affecting other parts of your life?
It was affecting all parts of my relationships with people, my relationships with my parents, just how I even see life. It became like consuming like the aesthetic that I want my life to be was based on something that's completely unreal and a fantasy land that,
And I feel that fantasy land that you were creating, that you were the god of, because you were essentially creating it, right?
Complete control.
It's we want control in certain arenas that when we don't have control in life, right?
Right.
And so, like, what I see from any doom scrolling is avoidance, right? You are not trying to deal with real life. You're not trying to cook dinner. You're not trying to, deal with the dirty dishes or whatever it is that you got to really deal with. So you're like, let me just entertain myself for a little bit, and you scroll. But it doesn't necessarily. So I think that's more tied to the avoidance behavior. But with regards to the school thing, I mean, I'm somebody who faced something very similar, right? Of just navigating being black in the United States, and for as an Ethiopian, my mom would always be like, "You're not black, you're Ethiopian," right? That was probably the most harmful thing she could have said, because it just confused the heck out of me. And it's not like cops are gonna be like, "Are you black or are you Ethiopian?" before they stop me, right? But it's also I had to come to understanding what it means to be a black person in this country. And like most, parents, my parents weren't able to teach me what, those intricacies were. They were learning it for themselves, right? Yeah. And so I definitely, felt like, okay, there's a right way of being, and then there's, me, and how do I bring proximity to, the right way of being so that I don't get the same consequences that black people face in the United States.
Yeah.
Right? And so I definitely understand and relate to that. But it really had to, I had to pretty much get to a place of understanding that, like, this society was not made for me, right? So I'm not going to find validation in mainstream media, right? I'm not going to find validation in public schools when they're banning Black history, right? You know what I mean? So it's just understanding the ways the society is set up, and then realizing, oh, I have to supplement these things on my own, right? I have to engage with my culture on my own. I gotta, be alone with myself, right? And then be okay with myself, right? Because at the end of the day, I'm the one who sleeps with myself every night, right? I gotta be with myself. So really working on coming to terms with who I am, and then that self-concept and being okay with who I am, right? And understanding that if I'm not happy, I can still change some things, right? But the things that I should change about myself is not my race, it's not my skin color, it's not the things that make me, that are part of who I am that I can't control. It's these other things that I can't control.
And also, John, I know you've been doing the research for the past year in the Coptic and Black communities. So I'm wondering if you had anything to like add to, because those two communities, specifically in Nashville, there's a lot of criminalization that happens in those communities and policing. So I'm wondering if you see any tie between, I know we're going to get to addiction in a second, but I guess maybe you can tie it to addiction, but if you want to tie it to feelings of shame or feelings of low self-esteem and being criminalized, or what you've seen in that research.
I particularly haven't spent a lot of time in that area in the 8 months that I've been in this particular role. However, I do know in order for me to serve the two communities you speak of, me as a white Caucasian male, how have I engaged my work? I've engaged my work by not coming into the work with any presuppositions and listening to people, listening to their stories, learning who they are, completely eliminate all of my presuppositions of what I think I know, even if I read it in a book, or how I've been conditioned to think based on the books I've read, academically, right? Because those things will condition, right, how I see the other, right? In this case, it's the African American faith community and the Coptic community. So philosophically, it's actually where my background is in philosophy. I kind of take those sort of skill sets into the workspace, and just because I want them to experience the other, me being the other, and say, wait a minute, this is a white Caucasian male who actually wants to know about me, wants to know my story, wants to know my history. And because I've engaged in that aspect, I think the communities have been very welcoming. It's taken some time because, relationships take time, right? And just not yet. But as far as the criminalization aspect of, within those communities, that's why a lot of times it's very difficult for people to come out and want to share their stories, want to seek help, right? Because they may get it from some of the gender conditioning we've talked about, but the societal system, the political system, is only exacerbating that problem, right? So.
Yeah, and I actually want to add to that in terms of the shame that I've witnessed with some of the communities that we work with. It's fear of criminality coupled with shame, right? Because oftentimes there are issues in the household that they need help with, right? And when you need help, you want to be vulnerable, you want to ask for help, right? But they're also fearful, if I ask for help, police are going to be called. Yeah. Or, DCS is going to get involved, right? And then, then they lose all control of the situation. Absolutely. Right? So they're really put in this position of, how do I get out of the situation that I'm in, but I can't ask for help? Because asking for help might put me in a bigger situation.
Yeah, we talk about even back in, the 70s, right? 80s, dealing with cocaine and crack, and blacks being criminalized and having harsher penalties because they're doing crack cocaine, right? Absolutely. And so how that mass incarceration only continues to perpetuate the cycle of, white supremacy and mass incarceration. And so being aware, going back to what you were saying too, I need to understand the histories. Because if I don't understand your history and I don't understand your story, how can I even help to begin with, right? And I don't want to go in there as a person. Like I said, I know I'm going to bring this up. I'm white, I'm Caucasian, I'm male. I'm not going to go into your community and tell you what you need. Right? You have to tell me what you need. And that's what we're really trying to do in behavioral health and wellness, because it is those two faith communities we're working with, but we're here to serve the entire city of Nashville, because there's plenty of underserved communities in Nashville that need resources and help. But just to broaden that and just listen to people and meet people where they are and meet those needs. And I think that's where maybe we can start changing and having that culture shift and paradigm shift to treat people as human beings. And maybe that's part of the addressing the issue of shame.
Less objectification.
Yes,
more
absolutely.
humanizing.
Absolutely.
And I think it's really interesting too, because one of the panelists that we had last time was saying that the highest rates of suicide now are among white men. So it's interesting now that like there's this vilification or public shaming of white men in the media, and now you see the suicide rates go up with that, and like the depression rates and stuff. So it's just really interesting to me how shaming and judgment, as opposed to like a culture of care or a culture of like humanizing people where you just objectify the person, just leads to the spiral of shame, addiction, guilt.
And I think, you know, we have Pick and Reach. I don't know if you all know about this, you know, but Partners in Care, and also our REACH program. We work closely with those, with that program. In fact, Alexis Hill, one of my colleagues, is moving in a particular role that's going to kind of oversee that. And it's basically you have a mental health professional who rides with a law enforcement officer in the Partners in Care program to respond to certain types of situations, to offer, you know, assessments, rather than going and just somebody's acting, you know, just causing a social or societal disturbance, and allows them to say, you know, let me go in here and see what's going on and get them the resources, whether it's the drive home, whether it's we need to take them to a treatment facility, whether they need to go to a mental health facility. But again, not putting handcuffs on somebody initially, right? And that's been extremely helpful. And of course, our REACH program is, instead of a law enforcement, it's actually with EMS. So, and the numbers, as far as bringing numbers down, has been tremendous.
That's fantastic.
So,
That's really good. That's really
and
good.
it's programs like that as public health to really kind of, you know, rehumanize people and what they're going through. So,
Do you think that objectification came from specifically white supremacy culture? The idea of looking at a person that is completely other than you and then just seeing them as not a human being, where is that kind of, I don't want to drift too far off topic, but because it seems like it goes like another personal, I don't want to also make it super personal, but I mean, it is like kind of like, you know, we're getting like intimate, vulnerable with the conversations. So like another like example from my life is that with my mom, she doesn't really speak English that well. So I remember moments growing up where we would be talking to people that we would meet from Nashville, and she would be speaking with an accent, and then people would make fun of her or be like, English, please, or like whatever, that the response to that. And I know that made her feel very like ashamed. It made her internalize a lot of things. So I don't know if necessarily it's coming from this like dominance aspect of colonizing aspect ideology, or where do you think that objectification is like coming from now? That leads to that.
I mean, yeah, I think it is, because English, please, really means cater to me and my, you know, needs, right?
Yes.
And so it's seeing yourself as, like, it's censoring yourself, right?
Yes.
And that is what white supremacy does, is like it censors whiteness as the main focus in all arenas of life, right? I mean, most people don't even know how a lot of the medical standards were created. Medical standards, when they created that, they went to like predominantly white area. You know, the study was done on all white males. Even the ACEs study, right? That was done 10,000 male white men. You know, so a lot of the research that we do, a lot of the standards that we have in terms of like, this is a normal value, this is an abnormal value. It's all on the basis of like researching white people and using whiteness as the norm, right? So when whiteness is the norm, everything that's not white is deficient.
Shameful.
It's deficient. Yeah, exactly. Right.
Yeah.
And that, but then there's like different systems of oppression that exist. White supremacy is one, but patriarchy is another one, right? And patriarchy, within patriarchy, even though patriarchy is about giving power and dominance to men, there's a lot of ways in which men are harmed by the patriarchy, right? Because we feel like, oh, I can't ask anybody for help. I just have to be the man. And we put ourselves in really harmful situations. And we're teaching ourselves, oh, you just have to endure it. That's what being a man is. No, you're killing yourself. You're literally killing yourself. And then we see, you know, men not having as much, friends, and as they age, them being more likely to commit suicide, that makes sense, right? We need to have protective factors. And if we feel like, it's that individualism, right? Because we're taught, you don't need anybody. You got this on your own. And that can maybe last you in your 20s and 30s when you got the energy, right? But when life catches up to you, when aging starts to happen, when your abilities start to change, and you have to have different forms of aids to walk or maybe to hear and things like that, now you're living in a society in which you need support, but you haven't cultivated that support.
Yeah.
Right. And so
Absolutely.
it's we have to see the ways that when we're creating relationships, we have to not just see it as something that we're doing for the now, but something that we're cultivating for the long term, right? Because we as people need support until we're gone, right? And then once we're gone, our families need support to grieve us, right?
Yeah.
And so it's that understanding that like the connections that we make are more important than just what this person can give you on the basis of, what is your value? What do you do for a living? What can you do for me? Because oftentimes we create our relationship on the basis of what can you do for me? This is where I am now. How are you going to improve my life? If not, I don't need you, right? And we need to take the time to, cultivate relationships with people who are different from us. Oftentimes we don't have that opportunity because of, historically, it's because of residential segregation. Meaning, when we were building houses, black people were not able to purchase homes because there were, redlining, segregation. And so black people and white people live far differently. They lived very far away from each other. So if you don't know people who look different from you, right, and you're not occupying the same spaces, the only way you learn about each other is through the media. But what the media shows us is stereotypes.
Absolutely.
Right?
Yeah.
So what we need to do is break these stereotypes and meet people, right? Meet people where they are. And that's what John was doing with his work, right? He met people in the community, took the time, because, trust builds at the speed of, or it's like build, what's this saying that's like we're building trust at the speed of? No.
I'm not familiar with that one. I don't know.
Like watching paint dry on the wall a long time.
Yeah, exactly. But when you're building relationship, it's at the speed of trust, right? And so that was what he was making sure that, you don't make people uncomfortable, but all right, once you feel comfortable with me, now we can engage in a more meaningful relationship. Now I can ask you about things that, matter to you, and you're more likely to tell me, right?
Yeah.
And we just need more of those relationships.
Absolutely. So for anybody that is maybe live streaming this, or anybody in our audience here, any men specifically that are dealing with shame right now, maybe they've been listening to this conversation and they identify, oh yeah, that's me. I didn't realize that these feelings I had, I didn't have a name for it, but it is shame. What would you say to those people that are struggling with overcoming that shame? Is there, next steps or any piece of advice that you would give to them to help them with that struggle?
Also, what does shame look like in a person, in an everyday person?
That's a 2-for-1 question. Yeah.
I'm gonna have to think about the second one a little bit longer. I would just encourage the men, if you are thinking about it, you're dealing with all these negative emotions, all this self-catastrophizing thoughts and stuff. This sounds easier said than done, but you got to reach out for help. There's so much help available out there. You can contact the health department, behavioral health and wellness division. You can ask for myself. We definitely want to be accessible to the community. We do hope by sometime next year we're actually going to have free counseling services offered to the community. Our director, Dr. Ann, is trying to really work extremely hard to get that done. So when that happens, definitely want people to come. But in the meantime, my number is 615-956-3916. I'll say that number again, 615-956-3916. That's my work cell phone number. Just reach out to me. If I don't know certain places to go, I can definitely get you connected. We have a team of people in our division that would be more than willing to help. So, but just making that first step and saying, you know what, I'm tired of this. I want to do something. I know I have potential in my life, and that's the thing. Each and every single one of you has potential. There's just some things that happen to you. Some decisions that you may have made that put you in a bad situation, but there is hope. And just want you to get the help that you need so that you can be the person that you want to become in this world.
Thank you. That's great.
I will not be giving my cell phone out. So let me say that immediately. But so I think avoidance is how shame shows up for a lot of people. So I'll answer yours first. Because when you're shameful, you don't want to show up in places that make you feel uncomfortable, right? You don't want to show up in places that make you feel ashamed. And so you just don't show up. You avoid these things. Yeah. And so I guess try to notice if there are areas of your life that matter to you, that you originally would show up for, that you're not showing up for. And then you can, try to see, is that due to shame? And then for people who are experiencing shame right now, I would let them know you're not alone. Regardless, you matter, your story matters, what you've gone through matters, right? No one else may understand, but try to find someone who's gone through the same experience as you, because there's power in finding, a peer support, because I can have a therapist tell me, oh, this is difficult, right? But then if I had somebody who actually went through the same situation that I went through, and they're helping me navigate, they actually know how I feel, right? So it's not, I can't imagine how you feel. It's no, man, I've been there. I was there last year, this, that. So finding people who've gone through the same experience as you, but also, reach out to a therapist. I know it's not always accessible. I know it's not always affordable. So hopefully resources like the ones in the public health department will support those, but definitely finding a group, finding a community.
Well, and I also want to, you mentioned, peer support advocates. I was at a lunch yesterday afternoon at a restaurant here in Nashville, and I think that there's a lot of residential treatment centers that are really trying to maybe restructure things to have staff like that there, because it's like you said, you can have doctors, you can have nurses, you can have other people that work on there, the so-called professionals. But it's like Benaiah said, I do think that peer support advocacy is really, really helpful because there's that solidarity there. You all have walked in similar shoes. You can share stories. And because of that automatic rapport, it's easier to open yourself up to somebody like that, right? So, good.
And to shift it a little bit, what would y'all say to, because family members who grew up with ashamed parents or parents with low self-esteem, it's really hard to grow up with that. It's really hard to have a brother or a sister that feels chronic shame or chronic guilt all the time. They have low self-esteem, they're not doing the dishes, they're not coming out of their room, you know what I mean? So, and you don't want to blame them, you don't want to judge them or anything, but how do you live with family members or friends? What can you do as somebody that's in the support system for people?
I mean, that one is tough, right?
Yeah.
Yeah, like clinical versus when it comes home, man, that's a whole nother thing, because the boundaries are not the same, right? Or the same boundaries that you would put in the clinical setting, you can't when it's your family, because it affects you a little bit more. Also, whether or not they choose to get care affects you, right? So it's a lot harder. So I would say first give yourself grace for what you're experiencing and the fact that you're even trying to be there for somebody like that. It's a very difficult position to be in, but in terms of the support for the family member, it's, I mean, really aligning the goals that you have based on, you know, this is how I'm impacted by the way that you are behaving, or this is how I'm impacted by the way that you interact with people in the house. Like, this is how this is impacting me. I want this to change. What are you willing to do on your end to get, you know, to change this? Are you willing to get support? Because you can't get help for somebody who's not ready to get help for themselves, right?
Right.
That's a lost cause. So you got to really base it on, this is how you're impacting me. Are you willing to get help? If you are here, you know, have those resources and walk them to them. Because sometimes you could be like, here's the resources, call them, versus, no, let me help you call them. Let me take you to the appointment, whatever it may be. So really be there for them in that way. But it's a lot harder when it's one of your family members. So I will preface that. So don't, you know, make yourself like the savior, and like don't put all the pressure of, oh, if they're not better, this is my fault, right? You're doing the best that you can. Be as much of a support as you can, but at the same time, create boundaries so you can protect yourself.
I would say definitely if you seek services and you're going through counseling, you're really trying to work at things. I think that is true, and something you do learn is the boundary setting, and just be saying, like, you know what, I am doing this for myself. I need just the support. If you're getting some backlash or whatever, oh, you know, you think you're better because now you're getting there, you know. Family has its way, right, of just trying to just throw as much as they can at you, right? So yeah, definitely setting up those boundaries, you know, for sure. And yeah, all you can really do is just share the information. When I was doing case management a couple of years ago, that's just what I told my clients, helping them with resources and stuff. They're like, yeah, I'm making all these changes, but it's just chaos still at home, and I know that this has helped me, and I want to help them. You know, what can I do? And I said, all you can do is just provide them the resources and share your story, and maybe that'll work, maybe it won't.
Let's get into addiction now.
Yes, it seems like the next logical step. So we talked from the top of this that shame and addiction oftentimes go hand in hand, and so we're going to move into addiction now. Do you want to start off with it?
Sure.
Yeah.
Okay, so take us through kind of somebody that smokes a lot of weed told me one time that it feels like their needs are being met when they are high on weed. They're like just feeling much calmer, much chiller, much safer. So maybe let's start with the childhood, and how does our childhood things that happen to us in childhood can lead to addiction?
Yeah, we do talk about adverse childhood experiences. I know it is limited in the way in which the research was done, like Benias did say, as far as the target audience, for that. But I mean, that is some of the root causes. Sometimes it's also undiagnosed mental health disorders that somebody may have. Yes. When I was working in an inpatient hospital and I was on the adolescent unit, some kids they didn't know what was going on, and whether it was anxiety, depression, and so they were just, self-medicating. So many people, not just men, but women as well, may have something that just goes untreated. And it just so happens that when you're an adolescent, you're literally just trying to experiment, right? And then you realize, oh, wow, I do have a little less anxiety. Obviously, the long-term effects once you come off of that high, biochemically and stuff going on, what happens in the brain, it's actually not beneficial, long-term. But in the moment, so also peer pressure, grief, the loss of family members, friends, or coworkers. And all different types of trauma as well. We didn't touch on this, but the Tuskegee study, that happened in light of the Black community, historical trauma, natural disasters, intergenerational things that can happen, things that are circumstantial. like war on drugs, chronic warfare, poverty, health equity. All these things are sort of root causes that can lead to potential substance misuse very early on. So,
so it was about childhood, right? What happens in the childhood that leads people to use substances?
Yes.
In childhood, one, how do parents cope with distress, right? Because if I saw my parents drinking is what you do when as you cope, right? So you learn all your coping skills from the people who are raising you, right? So if you see them lashing out, that is normal to lash out, right? If you see your parents fighting each other and then they call it love, you think love is domestic abuse or domestic violence. So oftentimes as kids, we're just sponges, just absorbing everything, right? And we don't know right from wrong. That's up to the people who are supposed to be parenting us to tell us right from wrong. So we accept things as normal, and we reproduce them in our own lives, right? And so when we're being raised in traumatic situations where maybe it's neglect because family is working 2-3 jobs, right? So there are the different circumstances that lead to these kinds of issues, but maybe it's just smacking the kid, this, that, or shaking the baby, whatever it may be. These kinds of things have an impact on the child's brain, the brain development, and their ability to process emotions and to process fear, right? Somebody who's had to deal with a lot of trauma in their childhood, their amygdala, the part of the brain that deals with fear processing, is hyperactive. They see everything as a threat, even things that are not a threat, right? And because of that, when you constantly see things as a threat, your body starts producing anxiety, right? And growing up, if somebody offers you a beverage, right, like alcohol, and you drink it, and you notice, whoa, that worked. That reduced my anxiety, right? And it's people don't know it because they haven't learned the science of it. But alcohol hits the same part of the brain as benzodiazepines, the drugs that they give you for anxiety, right? It hits the same receptor, the GABA receptor. So it literally works in the same part of the brain, and it produces the same effects, which is reducing anxiety, right? And so we're self-medicating, as John said, without even knowing it. We're just figuring out, hey, that thing worked. Let me do that thing again, right? And instead of learning positive coping skills, we're just learning, hey, when you feel this kind of distress, use that thing, right? When you're feeling some type of way, smoke weed, and then it'll feel better, right? And it's because, like, I ask people, why do people use drugs? Why do you, at all? Because they don't want to feel pain. We don't like feeling pain, and another thing that most people don't know is when you're using pain medication, your body, the way it processes physical pain is similar to the way it processes emotional pain. Meaning these pain medications, they also make the emotional pain go away, right? So when we talk about that in the context of this opioid epidemic that we're talking about, there's a lot of people dealing with emotional pain, right? And because they had a surgery, they were getting access to these opioids. Now, these opioids have been discontinued, but they're still feeling the emotional pain, and they want to get that feeling again. But now they can't get it from their doctor because now the doctors are sharing with the different pharmacies that you've picked up your prescription already from one place. Right. Before they didn't have this kind of tracking system, right? So people would go from one place to another, and you take as much. But now your drugs are limited, and who do you have to buy it? Now you got to buy, from the streets, right? And then now the stuff that you're buying is not certified to be the stuff that you think you're buying, and people overdose over that. But the whole point is people are in pain. We live in a society that causes so much violence and trauma, and we have very little skills to deal with the ramification of that, right? The emotional distress that we're in, the psychological distress that we're in, and so we drink. We work 60-plus hours, work hard, play hard. No, we're just coping from the fact that that is not what we're meant to do, right? Overworking ourselves to just barely make a living, that we're living paycheck to paycheck, right? People are going through things. They're struggling, and they're coping with it. That's really
Would
how
you
I
agree
use-
that we live in an addictive a society that enables and promotes addiction?
Absolutely. I mean, we make so much. When we do doom scrolling, right? Every fourth post is an ad. They're making hella money off of us. And now these ads are targeted to us because they don't need to put up billboards for things that you're not going to buy. Have you ever been like, hey, I want this grill, and now this grill is being advertised to you by Facebook or something? They know exactly the kind of products that you want.
Yeah.
They know what kind of content is going to keep you on these sites, right?
I'm laughing or smiling because that happens very often with
Yeah.
me.
Yeah.
I'm like, wait a minute, man, I need to like set this thing down, and like it's a little too much, you know? Yeah.
But you know,
Yeah.
all the systems and this is capitalism comes in, right? Because all the systems are working together to make money, right? So the priority is not, oh, how is this person's brain be impacted by hours and hours of Facebook or Instagram or Twitter or TikTok, right? Because we know certain places like China even created limitations on the kind of content that children can view on their version of TikTok. Because they did the studies and they realized, hey, this is actually bad for child brain development, right?
Yeah. Yep.
So, but here, because it makes money and because parents can't, supervise their kids 24/7, you're like, hey, here's the babysitter, be on your phone, right?
Yeah.
And so you get a little time for yourself so you can do things, but now the kid is just doom scrolling and being impacted in whatever way, and that is changing their brain, right? It is wiring it so that, like, now, like, more than 10 seconds, I don't even know if anybody's still watching this stream, right? Because we have such low attention spans.
Absolutely.
Right? Like 5-10 second videos is all we can handle because it's like, oh, I'm bored, So there's a lot of ways that it changes our brain. And so, this society is definitely making money from us for making it as addictive as possible. I mean, even black communities, right? Let's think about that. A lot of black communities like South Nashville, North Nashville, people are living in food deserts. Food deserts meaning that, in your community, it is very hard to access grocery stores that sell fresh produce. But what do we see in the same areas? 3, 4, 5 liquor stores on every block.
Fast food restaurant.
Fast food restaurants, right?
Yeah.
And fast food restaurants is addictive. Alcohol is addictive, right? But they also know people who are in these communities are dealing with pain.
Yep.
And they need to deal with that pain somehow, right?
Yeah.
So these liquor stores exist because they're making money, because they're addressing the needs of the community, but not in the ways that it's actually beneficial to them.
Yeah, and that going back to just child development, I haven't looked at the data or the research out. I'm sure we're going to see the ramifications of this ongoing sort of virtual world that we live in these days. But the constant dopamine that is triggered and that high, that feeling, and how it's even related to the increase in those who decide to end their life by suicide. It's rising, especially in 10 and 11-year-old girls, which is troubling. So.
Wow.
So one of our questions was, is addiction, is this genetic? Is this something that you choose? Or can you talk about that a little bit, or the differences there?
So there is some data to suggest that there is a genetic component to addiction.
Okay.
So that cannot be completely outruled. Although I always say it's so hard to differentiate the genetics from the lived environment, right? Because if is it the genetics, or is it that I'm living with the people who have the same genes as me and they're using these poor coping skills and I'm learning those poor coping skills from them, right?
And who is finding and studying these genetics as well? That goes.
Exactly.
It's like what you're saying.
Yeah.
Like,
Yeah.
who is deciding that this gene is the one that's for addiction?
Absolutely. So I think with that regards, it's really so there is some component to genetics, but at the same time, it's lived environment, it's access to it too, right? Because if you don't have access to these substances, it doesn't like immediately happen, right? So that's what I would say.
No, yeah, definitely a genetic component. I think sometimes that is a buzzword in the biological science. I mean, even when we look at the relationship between genetics and cancer or whatever, but it's like, you know, if we just look at our family tree, it's like, you know, we all come from very similar genetic, you know, lines. So if it was just completely genetic, then there's no room for environment and how that is. So I think that there definitely is a genetic predisposition there, but to second Benias, I think he covered it well. I think it's just all about what we experience, you know, the access to things, the economic and social situations that we're in can all lead to that, you know,
So what both of you are kind of saying is that we are all addicted, whether it's substances, because there's sex addiction, there's shopping addiction, exercise addiction, food addiction. So we all have an addiction, and it's about managing that addiction. And some people can manage better than others, or is it, can you live a completely non-addicted life? Is it just a fully balanced life where you're not addicted to anything at all?
Well, you know, with the work that we're doing in the community surrounding substance use disorder, I don't know if people have heard of substance use disorder. So, you know, we're starting to really change the language in the psychology world and counseling world, because we know that actually substance use disorder is actually not a moral failing. Some people think that it is. It's just a matter of choice, right? That it's just a matter of, okay, if you chose to do it, then you can just choose to go and you can choose to go and get sober, right? But just like cardiovascular disease and diabetes, it's actually a disease that affects thousands of people from all walks of life. So we have to look at addiction as a disease process. But anything related to mental health, because of the stigma that surrounds so much of it, we can talk about diabetes, cancer, heart disease, Alzheimer's all day long. But when it comes to substance misuse or any type of behavioral mental health disorder, it just becomes, you know, a big deal. So I think we need to look at this as a disease. Again, we may have predispositions to it, and for some, like you can have a set of twins and one decides to go down that road and get addicted to, you know, alcohol and or drugs, and the other one does not. I mean, how do you explain that? If it's a genetic thing, then how come one did it and the other one did not? Like, explain that to me. And I don't think science has yet proven that aspect. And until it does, we can't just say it's just a genetic issue.
Yeah.
So,
I think by saying it's a genetic issue, it's usually a cop-out, because that way we could be like, this person is deficient. They had the bad gene, right?
Yeah,
so they're the screw up. Yeah, it's very much eugenic.
It's a genetic issue.
Yeah.
Because if you're statistically seeing more of the addicted populations are populations of color, populations of people that are experiencing oppression or whatever, and so it sounds kind of like eugenics to be like, well, obviously it's the genes that are making this happen or making them do this or something like that, as opposed to the environment, like, and how the environment is coming in to like promote that addiction.
Yeah. And if anything, I would say if we're talking about a genetic component of substance use or addiction, I would say more of epigenetics. And epigenetics is the understanding that our lived experiences can impact the way that our genes change throughout our lives. So that, like, if we have, you know, for instance, our DNA can be methylated, meaning like the appearance of the DNA changes. So it has different impact, right? So it makes some people more or less vulnerable to certain things. So epigenetics is something that I can, you know, say, oh, this is impacting somebody's, you know, likelihood of potential substance use. But I can't say, you know, just genetics alone is causing somebody to behave that way, because it really, that is when you're getting into the territory of, you know, something is wrong with you instead of something has happened to you that has, you know, caused you to respond in this way.
yeah. So I think just to clarify, is it a matter of choice or a disorder? I am at 100%. I've been in this industry a long time. It's not just a matter of choice. Yeah. It is actually a clinical, diagnosable disorder like any other. Yeah. So
So I have a question. So obviously addiction is a spectrum from what you've seen. Does an addiction have to be ruining my life for it to be considered an addiction? Or if I, like, say after work, like, I want to have a glass of wine, and I do that every single day. Every single day after work, I have 1 or 2 glasses of wine, and I don't go overboard. I just kind of 1 or 2 glasses of wine, relax, meditate. I'm sitting in my garden. Would you say I'm addicted to alcohol in that sense? Or is an addiction something that is actively destroying your life and your relationships?
The thing is a glass of wine is arbitrary. Exactly how many ounces of wine are you actually having per glass? Right?
1 glass, but it's the full bottle.
Exactly. So it does depend on how much wine you're actually consuming. We do know that healthy people around the world, looking at the totality of their health, they do drink a little bit of wine, but it's to enjoy with meals, right? Like, it's not like certain cultures are not just drinking, just numb themselves or whatever. So again, it's in, and I want to, the number of ounces is actually leaving me as to what is considered safe and not
like
overboard.
8 ounces or something like that, which is
Okay. Yeah, I have to go back and fact check that. I'm not sure, but yeah. So we'd have to redefine exactly how much wine you are consuming on a daily basis.
Well, it's more of, so the question is more of, I'm doing something every day.
Well, this is my thing.
Yeah.
Can you stop one day? What happens if you stop? Because if you stop and you scratching and itching it, then clearly we got something going on, right? Where you now need this thing to feel normal, right? But if you're like, oh, I forgot to drink wine today, I didn't even remember it, then I wouldn't say you have a problem. Because if you didn't remember it and it didn't really affect you, physiologically, then you don't need it to survive. You don't need it to live.
Well, and I will say, I mean, historically, the fermentation process of alcohol has evolved over time. We're finding ways to just make it stronger and stronger and stronger, so it may take less, for us to feel those effects. And the question is can you actually go a day or 2 without it? And if the person cannot, then we may need to sort of revisit and see what's going on there.
But to add, like, there are so many different kinds of addictions, and some addictions we don't see as bad, right? For instance, overworking is an addiction, but in capitalism, that's you're like, oh, you're cut out for the corporate world, you know what I mean? Because those are the people that make the money. They're working 80 hours. We glorify that, right? But at the same time, like, what is at the expense of what, right? At the expense of family, at the expense of relationships, at the expense of your own health. Because I also know a lot of people who work 80 hours. They have very much like work hard, play hard lifestyle, right? They use cocaine and other sorts of substances to keep them at the level that they, are. So, with everything, it's really understanding what all comes with it. Because not many people know, but even doctors work 80-hour weeks, right? And in the past, in the 30s, 40s, the reason people did that is because as a doctor, you're allowed to do coke while you did your work. So you had to stay up, right? How do you stay up for 80 hours a week to round on patients when you're working 24-hour shifts, right? Yeah. In the past, they used to allow people to use cocaine. Now that doesn't happen, but they still have the same expectations of you better be up, you better be alert, you better be there, right? And so what does that do? It causes people to now have to self-medicate so that they can stay at the same level of productivity, right? So we don't always see different things as addiction, especially when it's in line with what's right in our society or what's normalized. Yeah. But no, there are a lot of things that can be harmful to us.
Yeah. I always just say even the level of tolerance. I mean, I can point at my own life. Like, there was a time period, like last year, I was starting to have wine, with my wife at night and stuff like that. But it's like, 1, okay, this is all right, maybe 3 or 4 ounces, and then it became 2, and then you just, you just don't think about it. Next thing you know, you're drinking bottles of it. So it's
So first it was an addiction, and then it became an addiction.
It could possibly become. I saw that being an issue, and I was just like, wait a minute, because I do have those that struggle with substance misuse disorder, and so I see that aspect of me, and I know that, And if I was an alcoholic, I'd be the worst kind. I would be the binger because I don't have that self-discipline to stop, right? So it was, but for me, it was like, okay, this is just, you know, too much. What I'm saying, my point is you just develop tolerance whether you want to or not, right?
Okay, so that brings up an interesting thing. So that's kind of what I was trying to hint at is, so you're saying that you would be, if you were an alcoholic, you would be a binger.
Correct.
So I'm assuming that there's aspects of your life where that comes out in. So what I'm saying, you don't have to get personal or anything, you know, and
It's fine.
I put my whole family on blast throughout this whole program. I've talked about every single person in my family, but you don't have to do that. You don't have to get personal. But I'm just saying, how do you manage that, and how do you cope with that? Because I know a lot of people that have addictions are bingers, or they get into something and they can't stop themselves from doing it. So is there a positive addiction, or do you manage that somehow?
So for me, I'm kind of like a health guru, so it's kind of ironic that I am talking about, you know, drinking, you know, wine, you know, et cetera. But so I just kind of rechanneled that. Like I lost my grandmother this past July. She just, I think 4 days after her 90th birthday. And I mean, even when I was up in Michigan, I was with family. It was like, you know, it was there. The scotch and bourbon was there. And a part of me was like, hey, I'm with my uncle, I don't get to go up there very much. I moved down here to Tennessee when I was very young. And so I was like, you know what, I'm just gonna have a good time with my uncle. But then the entire 3 or 4 days I was there, that's what I gravitated to. So I'm on the plane with my wife, Jessica, and I'm just like, Jess, I just spent 3 or 4 days nothing but self-medicating. I was like, I've gotta find something else. And so I just got back into, you know, working out again, eating more, you know, whole foods or whatever to clean my liver out and to just clear my mind, because nutrition is very important as well. Because once you start feeling better, it helps to kind of appease that desire for more alcohol, you know? So yeah, I just went from that to just looking at lifestyle practices that allowed me to implement that as a healthier response. But it's not like I'm going out there and you know, I'm exercising for 5 hours a day, right? Like, you know, it's 4 or 5 times a week for an hour and a half, you know? So yeah, it's amazing. Even though those of us that work in this field, we all have the potential for substance misuse, no matter what happens in our life, no matter how old you are. And that's the vulnerability aspect. Because anytime somebody feels like they're above it and they want to intellectualize and rationalize it, you're down to a slippery slope.
I was with I've been a social worker before this, and I was doing 7 years of social work. And the first years of it, I was a vegetarian for like 5 years. And then after like the first year of social work, I distinctly remember a moment where I was like, oh man, like, you know, F everything. And I ate like a pepperoni pizza, and I was just like, all right. And then that spiraled now I'm a full meat eater. So there's certain things, like you're saying in the field, where you're like, all right, this just triggered me to just like kind of just say, all right, whatever. Like, I don't even care anymore. There's way harsher things. But it's about, I guess there are positive. So you're saying, so to go back to the genetic thing, what I read is the gene is how sensitive you are to your environment. So certain people have a genetic trait that makes them sensitive to the environment, and then that would then trigger an addiction if it's not dealt with. So do you think people who are like, I don't know what synonym we could use for the word sensitive, like people who are, they feel everything strongly and they're just very like, you know, what role does that have in the addiction? And do you see that with sensitive people, and do you also see that with like not sensitive people as well? Or do you see like, what kind of people tend to have that substance use disorder or something like that?
That's a good question.
I mean, I would say it goes back to, if you're sensitive, you're more likely to feel pain from certain things, right? So with me, substance use always comes back to pain. Are you feeling emotional, physical pain, right? Or are you feeling, are you feeling safe? Are you feeling valued, right? Because we have like needs as humans, right? Even to be acknowledged, we don't like when we're in a room and somebody doesn't even like acknowledge our existence, right? And that may be some of the feelings that you have felt in high school when, sometimes they'll acknowledge certain people but not acknowledge other people, right? So we want our humanities to be recognized as human beings. When our humanities are not being recognized, we feel othered. When we feel othered, that pain, we want to deal with that pain. Some people can work, I'm going to just work off, or, that doesn't really matter to me. These people's opinions don't matter to me. But if you're, the more sensitive type of person, you're like, man, this is really bugging me. I can't get this out of my mind. Now you're ruminating on it. Your mind, is kind of bringing it back up. Then it starts impacting you in ways where you're like, all right, how do I get this out of my head? Let me, do X, Y, Z to make, to take the edge off. And so if you're more sensitive, I think you're more likely to be impacted by certain things.
Yeah, for sure. I mean, I'm not sure if there's much I can add to that. Yeah.
I want to kind of take the conversation just a little bit to a different place. I want to talk about hope for just 1 second. So when somebody is in the throes of addiction, when they are deep in shame, how do you find hope? How do you find hope to get help or to tell someone, hey, I'm trying to be vulnerable here, and I want to let you know that I'm going through some stuff. Like, do you have any experience with maybe in your own life or people that you've worked with, how to get them to a place where they feel hopeful? Last month we had a conversation in this series all about suicide, and one of the panelists said, most people, it's a blanket statement, but most people that are thinking about suicide, it's not that they want to die, they just want the pain to end.
That's correct.
And so you've both kind of touched on that today, but my question right now is where do people find that hope to get through all of this? Because it can just feel daunting and like,
yeah.
Where's the first step? What do I do? I kind of want to touch on that for a second if we could.
Yeah, I know with substance misuse, the potential for accidental, overdose or, just causing extreme harm to yourself is there. I don't know if people know about this, but the suicide crisis line, 988, it's an easy number. If you're in a situation where somebody needs to call 911, please call 911, but 988 is there. Even if it's just to talk to somebody. It doesn't mean that you're going to immediately go to the hospital, right? Anything like that. You can talk to a professional. Eventually, they'll probably do assessment if they deem that necessary, and to get you the resources. So 988 is a fantastic way, for that. FindHelpTN.org is a great website for people to go to. I'll say that again, FindHelpTN.org. And then also the Tennessee Red Line. That's 1-800-889-9789. I'll say that again, 1-800-889-9789. You can call or text 24 hours a day, 7 days a week, and they can get you connected with resources as well. So just know that it is available. It's just all in the palm of your hand if you have a cell phone. If not, I'm sure somebody can let you borrow one. So yeah, that's where I would go.
To find hope, this is a tough one.
Yeah, sorry.
I would do it on the basis of first understanding who the person is and what they value. If they're somebody who values, faith, right? Maybe their faith is their source of hope, okay, right? So connecting them to their faith groups, pastors, things of that nature. If they're somebody who, their hope comes from, I just need to, get through X, Y, Z, right? Helping them find resources so that they feel more hopeful in being able to, get across whatever situation that they're currently experiencing. So really understanding how people get hope, because not everybody experiences hope in the same ways, and not everybody has the same source of hope.
That's true.
So trying to really understand what makes people tick, so that you can use that to kind of work with them, because a lot of times people who are going through these kinds of things, their brain can't think of anything outside of just the pain and the the misery and this and that. So sometimes it's like they can't think of all the bright ideas that you probably have, right? So just be a source of like, hey, have you tried this? Have you tried that? Would this work? Would that work? Right? Until you understand what it is that actually clicks for them, and then connecting them to that. But that and just connections, right? Connections. The ministry of presence. People don't realize how important it is to just be there for somebody, and with your presence, like, I don't have the right words to say, I don't know what to tell you, but I'm just gonna be there, here for you. Is that okay?
Yeah.
Right?
Yeah.
And sometimes that's all you can do.
Yeah.
And that's such a foreign, it's so sad that that's such a foreign concept, especially for, I think, men in this current society and men in this country, that seems like such a wild idea, but it's really basic, right? And but yeah, I could see where that would just saying like, hey, it's okay, we'll get through this. I'm gonna be here with you. It's kind of wild that we've gotten to a place where that's
for sure.
Do you think it has to do with like the body? Because if we can talk about the body a little bit, because I think so. It's pretty intense to go from feeling deep shame to feeling hope. Like that's like a hard ask to ask of somebody. So I'm wondering if like the body has something to do with it. Maybe hormones, or maybe like, in your work, have you seen a connection between the mind and the body with that kind of like being addicted or being ashamed or being like, because I'm just thinking of like, there's like older men that, because I guess like once you hit 70, you hormonally just kind of start to like disintegrate into like something weird. I don't know. So a lot of men just kind of like are depressed, but they don't really know why they're depressed, and then it makes them really ashamed, and then they're living with some type of disease in their body that could be cured. But like, is there like a body connection to it? Like, could it be like you have a disease, you have an illness that's like a physical illness that can be cured, that can help you with your addiction, like help cure you of your addiction, or help cure you of your shame, or do you know what I'm trying to say? Like,
I thought it was the other way. So like, I can think of issues with your body that can lead you to have shame, right? Like, for any, like, oh, I'm experiencing erectile dysfunction, so now I feel less like a man.
That was the number one thing, right?
Yeah, right. So and this is something that happens as you age.
Right.
Also, if you have high blood pressure, some of the medications, right, may change the pressure within your penis, and then that leads to erectile dysfunctions. Yeah. There's also certain psych medications, for instance, have the ability to affect your your ability to get an erection and to shoot, right? So these kinds of things can make you feel like less of a man. So I can see the ways in which the physicality causes shame, but in terms of how does it like repair the shame?
Yeah, like, so I guess I'm thinking more of like this kind of like a weird question, I guess, to ask, but it's like, so like, I'm gonna just keep putting my family on blast out here. But so my dad, he's 73 and he's had prostate issues. And after he went through his medical kind of journey with his enlarged prostate, it seemed like it really, really affected his mood, his life, like everything was affected after it. And they were like, oh, well, you can take like TRT after getting your prostate, I think they shoot it back. Yeah, like they like laser it back down or whatever. But he just didn't want to do that because he didn't want to, just accept, he comes from Egypt, countryside Egypt. There's like the machismo, masculinity aspect of it. So he's not gonna, do that. But it really, really affects his mood, and it really affects how he like just lives every single day, and all of his relationships are totally affected. And I think it leads to shame, and it leads to like this sense of like, I'm not enough, this sense of like guilt, which then spirals and comes back and is now affecting his body physically with like his heart or his blood pressure, or that he's having like more like shortness of breath, and I think it's not due to like him aging. I think it's due to him kind of like going back into the cycle of like, I'm not enough, or I'm not a man, or so like how can we like get out of that? Like how can we get out of this like idea of like bodies and like what our bodies make us feel like that, or is that ever possible?
You know, it's interesting because I feel like sometimes in medicine we bifurcate the mind and the body. You cannot treat the mind and not treat the body as well. And thankfully, that I believe that the medical system is kind of bringing those two realities together, right? You know, it's hard for men to seek services for substance misuse or to just get counseling or whatever. I mean, for one, and number two, a lot of us, we just don't actually go and get regular checkups.
Yeah.
We don't want to go to the doctor because we don't want to get the diagnosis or the potential diagnosis, right? But if we do and we get those routine exams, we can intervene and you know, integrate lifestyle practices. So I'm actually a part-time health coach besides working for the health department. So a lot of times when I'm doing my coaching, it's like, you know, you have this stuff going on. We can look at different things lifestyle related. Obviously, I want them to make sure that they're talking to their doctors about this if they want to do lifestyle type kind of medicine, right? Because there's probably most likely going to be positive results, which may adjust the medication that somebody is taking. You know, so, and just over time, that may instill hope. So I help people with hope, whether it's substance use or mental health with resources, or if it actually is, they're dealing with erectile dysfunction, whatever. There are things we can do to reduce the risk of potential side effects of medication through lifestyle intervention. And that empowers them, right? Because then they're like, oh, I don't have to just sit there and just be in this shame like we talked about very early on when we started having this conversation. And then they're empowered to do, you know, to do something. So yeah, that's just how I approach that aspect. Yeah.
And there may be a bit of grieving going on, right? Because
Of course.
I think we don't, as a society, we don't think or talk enough about different abilities. Just ableism exists in our society, right? People who are different, people who have different abilities have a harder time navigating life in the spaces, because the spaces that we currently have are made for people who are, you know, fully abled, for people who don't have mental illnesses or anything of that nature, right? And so a lot of men really need to think about what life, like the time scale, right? From being a young boy, you know, to growing old, right? And our body's changing. And sometimes our body's not working in the same way that we expect them to, right? And that in itself, we have an expectation, right? That's not being met. But instead of it's being external, it's our body that's not meeting this expectation.
Yeah.
Right? So now you're at war with yourself. You're like, why don't you do the things that I need to do? I need you to do this, right? Like, why is this not working? Why do I need these medications? Why do I, you know? And that makes people feel inadequate. Like I need all these things to help me. Right? And we sometimes you've probably seen these videos of, you know, these older men trying to be their youthful self and then tweaking something and hurting themselves, right? It's because we're not in the same page in terms of like what our limitations are, right? And sometimes we have to grieve that like we're no longer the person that we used to be, right? And now we have to navigate life a little differently, right? But we have to still be able to find hope, find joy in being who we are in this new version of ourselves, right? Because we're constantly going to change. And sometimes we can, you know, control the reasons why we're changing. Sometimes we can't, right? But we got to be able to embrace who we are in the different stages of our lives and the different abilities that we have, right? Because you may not have the same abilities, you know, when you're 20 that you will when you're 60, right? But you still matter. You're still valuable, right? And it's even the kind of culture that we built up where people become valueless, useless when they're old, right? We don't value old people in our society. I come from Ethiopia. Old people are, you know, like we respect, worship, because because they've
those
been through it
individuals
all.
have wisdom, right?
Exactly.
If you want wisdom, you go to the grandparents or whoever, right?
Yeah.
And somehow we just here in
Just Google it.
America,
Just Google
we
it.
just don't do that. We don't value the aging population.
Absolutely.
You know.
And it's fine that the body falls apart. Like in Egypt, it's fine that your body falls apart. Or
Yeah.
I don't know how it is in Ethiopia, but I think it's kind of like the same. Like you
Well,
get
because the
older,
community is there to
yeah,
take
is
care
there
of
is
you.
there to take care of you,
Yeah.
and there's no shame to it. But I feel like
Yeah.
in America, there's shame. Once your body starts falling apart, you are useless to this society. Like you cannot work.
You see yourself as a burden.
So you see yourself as a burden.
Where in other societies, it's like,
Yeah.
oh, everybody else sees it as, oh, we got to take care of this person. Here, you feel like a burden, right? And that's where the suicidality comes in.
Yes.
Because when you feel like a burden, you don't want to ask for help.
Right.
Because, oh, they already have so much going on in their life. Me adding on to their, no, you matter.
Yeah.
Like this
absolutely.
person rather have you in their life being a burden to them, whatever you want to call it, than you not being alive. But oftentimes we don't give people the option. We just, oh no, they don't deserve to have to put up with me. It's like, no. Like people are not putting up with you. You deserve to be here. You're valuable. You were born to be here, and you should continue being here as long as you can, because you have an impact that you're making on other people, right? Other people were meant to see you. Other people were meant to learn from you. Other people were meant to, experience the greatness, the joys, the personality that you have. But oftentimes, in this capitalistic society, we measure people's worth based on how much can I get from them. How much, what is their value?
Yep.
Do they have, clout? Do they have, can they improve my social standing, right?
Yeah.
Are they somebody that has money? If not, oh, this person's valueless.
Yeah.
But that's not true, and we have to reevaluate what we value and how we, value other people in our
I
society.
think it's just part of that accepting of the aging process. Yes, we do, going back to epigenetics, we can, nutrition-wise, can help really kind of either prevent and or reverse or slow down some of these disease processes so that, the hope is there. But I think if we come to more of acceptance with a lot of things, it could potentially prevent us from going down that path of using substances to self-medicate, right? We try to find every way to distract ourselves, going back to the technology thing earlier, to just sort of disregard, and not being honest with ourselves and saying, no, I need to go get checkups. It's okay for me to go to the doctors. It's okay for me to feel bad. It's okay for me to process my emotions. It's okay for me to set boundaries with myself and also my family. All these different things. But unfortunately, we're just not conditioned as men to actually, live that way across cultures, so.
I was gonna, that's a lot. I wanted to see if we have any questions, either from our in-house audience or our live stream audience. Have we had any questions come through?
Not on the chat.
Not yet. It's been a lot. I get it. No pressure. Anybody in person have any questions they want to ask? I think we're good there. Oh no, we do have one, and I'm just gonna repeat it just so it gets in the mic. But yeah.
Oh, okay, fair enough. I'll try to shout here. First of all, thank you to all of you guys for taking the time out, just individually and then collectively. And there's so much I can hang on here, so I don't even know where to start, just because you touched upon so many points that just I'm not a professional in the leagues where you guys are, but I do speak to other men in a different sense, coaching, mentoring sense. So seeing it, really deep diving, wow, very profound. So thank you individually and collectively. So try to take some notes as we went along here. This I'm going to go something with a pop culture first reference, and then maybe go to a deeper spiritual side. So if I mention the name, I'm probably going to mutilate this, Chuck Palahniuk, does that mean anything to anybody? Anybody know who he is?
He's a writer, author.
Yes, right, author.
Yeah.
Probably worked for Walter, right?
I do.
Yeah.
Nerd over here.
Well, he's the writer of
Now I know who you're talking about.
Yeah.
So, I've kind of recently, and I say recently, the past 2 to 3 years, kind of rediscovered going back myself. I'm like, all right, and, as I'm, not midlife crisis, but in a way, I'm kind of collecting along the way. I was like, all right, what's that impact? And I believe Fight Club came out in 1999, and so did The Matrix. So, just a general, lighter conversation.
I love it.
I'll just keep diving with you guys. If you can remember Fight Club, obviously I think The Matrix also, where do you see, but as Fight Club was more, centered around, masculinity, that men in the late 90s, but also, if you can think about how that is playing out today. I'll just say as an example, Fight Club was Fight Club where men wanted to, we were just, pussifying ourselves. I see that, there's so many ways I can take this conversation just because you touched on so much. Where like right now, like the biggest thing, or one of the bigger things is UFC, which was nothing purely underground in the late 90s, but right now is just the most dominant thing where we just want to see men really, end some game, beat the crap out of somebody, no holds barred. Now it's obviously gone into women. I'm not, it's got so many parts I could probably stick my toes into here.
Mhm.
Or maybe see something incorrect. Maybe you're recording this.
Right.
Again, maybe just, if you can recall this, maybe, once again, I'm going pop culture first. That's just been on my mind, and just seeing how different aspects of that movie really, where I'm seeing it, maybe it's, I'm getting confirmation bias. Different things, but at this point, it's the example of Fight Club, UFC, holy shit, that's just one example. But then the example of also like what we're supposed to do, at least in the 90s, when I got told, get a good job, get a good education, buy the house, buy all that, which I subscribe to absolutely zero. But I'm a consumer also. Consume. I also have my, spiritual side of me, which wants nothing, but wants everything in a capitalistic society. So, I don't know, take some comments away from that, just spitball around it. Anybody?
Wow.
Yeah, no, that's a really interesting.
I don't know if anybody recalls Fight Club.
Oh, for sure. Well, yeah, it was like I said. As soon as you referred to the movie, I knew what you were talking about. We talked a lot about today about the digital age, and especially with young people growing up, young boys and stuff, and so a lot of people's education comes through movies, right? It comes through social media. It comes through these or pop culture altogether.
I say sugar sells, right? And that's,
Yes.
nobody, let's not go into politics, nobody cares. That's another piece from this thing. But yeah, pop culture,
Yeah.
that's what, especially, not even, past 10 years, we all know that the world is in our pocket. We spoke about doom scrolling, everything else. That's what we start seeing as examples. And whether, where you're 13, 23, or 33, and you
Yeah.
know or you don't know, you're just getting all these feeds and everything's like, well, I didn't know if I wanted that.
Yeah.
Now I am going to have a grill that's going to show up on my Facebook ads because you guys have been speaking about it, and I'm speaking about it because they're listening to everything I'm saying.
Yeah, well, and it goes back to a term called mimesis, right? This idea of we learn, we see things visually, and we repeat them, right? Another way of saying it, learned behavior, right? So when you talk about Fight Club and UFC, it's just that masculinity. I'm going to be tough. I'm going to bash somebody's head in. I want to make millions of dollars. I want to do that. I mean, I actually was a health coach about 13 years ago for a group of guys who were working on, becoming fighters and stuff, and doing the jiu-jitsu and all that stuff, and did some rhino fights here actually in Nashville. And it's amazing to me how much time and energy, right, they put into that, and they value that. But then when they go out there on the ring and they actually lose, they have no sense of dealing with that. right? And so a lot of them, they got into using alcohol and drugs because they put their entire identity in that, because there's not any other type of role modeling going on that advocates for the kind of stuff that you were taught and I was taught, right? You know, you obey the law, you know, you go to school, you get a degree, you work hard, you get a job. And I think that's that pop culture aspect, and it also perpetuates the cycle of violence as well, which we could go down, you know, a huge bunny trail there. But
It's not WWE,
right.
where they convinced that they realize it's entertainment that
Yeah.
perhaps we or some of us grew up on, which was more cartoonish and flamboyant. I mean,
Yeah.
this is literally, you know, I mean, it is what it is, right?
Yeah.
And culture does not, you know, we applaud the winner,
Right.
right?
Yep.
And then the loser, you know, lives in shame in himself, and then doesn't have his group or his team or hang-ons, and
Yeah.
he's not able to, you know, come out of it.
Yep.
But then if you do come, I don't know where I'm taking this, by the way. If you do come out of it, whether you have some addiction or whatever not, and then we're celebrated sort of like years later. I'm thinking about some senator or some minister who's advocating for all this, did the complete opposite, and then
Yeah.
I don't know, this societal swings and just where we are pop culture wise. But perpetrators, you guys threw out a word. One thing is, so I speak about trying to, you know, accountability or even vulnerability. Just the not the, I'm gripping around the word shame, to acknowledge first to yourself, to have the shame, to bring forward the shame is itself, I don't see men, I'll just say as we grow older, because our groups start limiting ourselves, because, you know, we're working all the time, most of us say have families, and we hang on to the one or two college buddies. We're not, you know, we have that one or two persons that we get along better at work. We're not opening up our relationships, we're actually narrowing down the more, you know, every 3 to 5 life or years in life as we progress.
Yeah.
So,
Yeah, I think with the pop culture stuff, and also, I mean, in academics, we call that the atomization of culture. And what I mean by that is we just reduce reality just to the human person, right? And whether that's constructing your own reality, right? And so who you are is just a combination of just will and actions, and you need to sort of just create yourself and build yourself up. That is just so contrary to evolution and the movement of, you know, humans, right? There's no sense of connection and community. It's led to hyper individuality in the United States. That's another aspect or component to this issue we're talking about, which
yeah,
then,
we're all celebrated to be unique snowflakes.
yes.
On that part. I mean, I advocate for that myself in a different sense that I'm going to share with you guys later.
Yeah, I mean, and so that puts tremendous amounts of pressure on the individual. This is not just for males, but it's also for females, but I'll just speak for males specifically. And then, so based on all these gender conditions that we've actually talked about, that type of system in culture and pop culture that we're in only makes the issue even worse, right? And so that's why, you know, substance misuse is just going through the roof. Suicide rates are continuing to go up, even though we have all these resources, we have access to care. However, we need more access for the poor who have no insurance. I'm not going to get into that, but that's something I'm advocating. Yeah, I'm definitely advocating for that kind of work that I'm doing at Metro. But yeah, so I'll leave it there because I definitely want to hear what these other guys have to say.
So should I go back to the?
Go wherever you want to go.
Yeah. Well, I agree. The pop culture adds to the cycle of violence that's already existing. And oftentimes people are not very creative, right? They need other things to look at in order to replicate. And so people are viewing these things as potential options, right? And people are also very good at evaluating how effective these things are at improving people's life, right? So if you look at the people who are doing UFC, they're making a lot of money. They're getting all the women. They're getting all the attention, right? And somebody who doesn't have all of that is like, hey, this is my way to get all the things that I need in life.
Yeah.
Well, I mean, if, I guess I'm a disclaimer with stereotyping, but from other cultures, which had seen, I'm not a big boxing guy, but I would see like someone like just hearing about others like an Oscar de la Hoya or someone, you know, in other, again, I'm not trying to diminish third world countries, but that was an outlet years ago, you know, to get out and, you know, the scene, you know, like UFC is just now, once again, that's in our face, in the culture where we are, which is America,
Yeah.
you know, which, once again, I'm going all over the place.
No, it's
Yeah.
interesting at what point, because you're saying if you don't do this to get out of the economic, social situation which you're in, then there's no other avenue to succeed in life. You
Yeah.
have to be the best boxer.
Yeah.
You have to be the heavyweight or middleweight champion, you know, whatever it is.
And
right?
it changes from culture to culture because in certain communities it's like, oh, football, basketball, right? Like NFL, blah, blah, blah. Whereas there's all these other opportunities. Tech, right? Tech, they're making so much money in that field. We could easily be, you know, let's push people into STEM, this, that. But it's very much, oh, the football, the basketball, the this, the that.
Glorified, but then it's also, again, access to resources.
Absolutely.
I give an example. I selfishly just grew up outside, you know, the Bronx, and as a kid, I would go into New York City, driving through the Bronx, early '80s. Wow, crazy. But there's a difference. I was just like, wow, why different players play basketball versus football? Because the accessibility is, or soccer. Why is soccer the biggest sport in the world? Because what do you really need to play soccer? A ball and maybe 2 cans of stick to make a goal. Versus if you want to play hockey, good luck.
Yeah,
You know?
exactly.
Access to resources and such.
And literacy and education too comes into it, like with what you're saying. I grew up on WWE, so I was like, that's what informed my masculinity, I guess.
It did
I remember.
Hey, I'm old school. I'm going to show my age. It was WWF and
Yeah.
and
I watched
also
WCW.
WCW. That's just me.
WCW.
Yeah,
Yeah.
man, so.
But even a lot of those dudes became addicted
To substance.
while they were on WWE. Like Ric Flair was like totally sober, and then after he joined WWE, he was like drinking like 700 beers a day or whatever. So they were like living out the character that they wrote for themselves, which is like really interesting.
Become the embodiment of what you are, you know, because there's yeah. When you put yourself out there into the world, say career-wise and everything else, that who you are, say when you just come home, and is there, you know, do you start believing your own self, or is there a way without
Well, and it's interesting because,
typically lead heart first,
Yeah.
head strong,
yeah,
therefore you are in a true alignment of self. So to have those conversations
yeah.
with just a man or men in general, even to open up that conversation.
Yeah. Well, it's interesting because we tend to be more gracious to athletes, to movie stars, to successful business people, what have you, that if they end up with a substance use problem, we're much more gracious. But and when I say average, I'm not trying to dehumanize people, but what I'm saying is people that don't have that type of career, somehow it becomes more of a problem, and they're dehumanized, and they're categorized. That's got to change,
Yeah.
right?
I completely agree.
A good
I mean, even
example of that too. Sorry, but a good example of that is like with the environmental movement. So now I think where the shame is coming in is that a lot of people are realizing like, oh, like the way that I'm living is destroying the planet. Like literally, like here are the numbers, here's the stats and stuff. And then the avoidance of like not wanting to face that or say like, well, I want to use my washer and dryer because it's like way easier to like, or I have to like drive because it's like way easier or whatever. So there's like avoidance with it. But like when I was growing up, like I was like advocating for like the climate change and like the environment and stuff. And people were like making fun of me like a lot of the time for it. But now it's like on trend. Like now it's like trending. So now you're like more like, you know, you can be a man and like advocate for like the environment. Whereas like, dude, like 12 years ago, that wasn't really like the thing. You're kind of like doing it. You're like, I don't know, you're seeing it a different way. So like, that's like goes into like kind of like what y'all are talking about with like, so how the social stigma like also like sees it. All being judged somewhere or another.
But different ways.
Yeah.
But different ways. I mean, even substance use, when we talk about like the 70s and the crack epidemic and all that, and the way we talk about substance use now, right? Now that it's like the face of substance use is now white. Before the crack epidemic, the face was black, right? So the response to it was punitive.
Yes.
Now that it's white, the response to it is we got to provide care.
Yep.
We got to provide naloxone. And I'm all for it. I want people to get the care that they need, but we also need to realize just the ways that our biases plays out into who's deserving of care and who's not.
Yeah. One of the things I wanted to touch on, because I know we're almost out of time here, is when we look at substance use disorder, the conventional ways of looking at it is it's either complete abstinence or it's, you're in active addiction, right? There's no really a whole lot of in between. So, and I know sometimes when people like relapse and stuff, and shame comes in, it factors in that. I worked at a rehab about 8 years ago, and when I was counseling a lot of the guys there, I mean, it was just over and over and over. It's like, man, I'm here like for the third or fourth time, and you've been here for like a year, and all that stuff kind of floods in. So what I'm saying is sobriety doesn't always look that way, like as far as complete abstinence. So we have medically assisted treatment programs that people can get into. Street Works, I know that the health department is working with them to do some work in the community. Maybe it's safe needle exchange to drive down, infections of HIV, et cetera. I know that's very radical, talking about that kind of stuff. That's sort of harm reduction practices, but it's about saving lives and waiting for people to get the help when they're ready. So again, I don't want people to get fixated on that, I have to either be an active use or it's all about abstinence. So I'm hoping that Nashville will catch up to states like New York. This gentleman here who's from the Bronx, because we have to decriminalize it. We have to destigmatize it. We got to start treating people like human beings and meet people where they are, help reduce infections. The list goes on and on. So I just definitely want to touch base on the harm reduction aspect of it because, like I said, sobriety doesn't look the same for everybody.
That's exactly right. This has been a fantastic conversation. Thank you for joining us today. We will do this for the next 3 months with other important topics that we're talking about in regards to men and men's mental health. This has been the Nashville Public Library. Thank you to our esteemed panel here. Thank you for our audience participation. We'll see you here next month. And just remember that